Gastrointestinal 2 case study. We have a 19-year-old female client who presents to the emergency department and she's reporting bloody diarrhea. She reports that she's been told she has irritable bowel syndrome or IBS in the past, and she does sometimes have bloody stools, but this is the first time that she's seen this much blood. She reports she's had 5 to 10 bowel movements daily, and she's already had 3 this morning. She reports that she is used to that, especially if she eats greasy foods. And she states, I had just accepted that I would never poop normally, but I've never seen that amount of blood before. It was crazy. She does report a weight loss of 10 pounds in the last 4 months. So let's identify some cues. Bloody diarrhea. History of IBS, up to 5 to 10 stools a day. Increased stools with greasy food. And 10-pound weight loss in 4 months. Potential causes of the bloody diarrhea might be because of illness or infection or cancer. There might be a perforation somewhere in the intestines. Or she may have a GI bleed, potentially from an ulcer, for example. The history of the IBS, what are those implications? Well, she could be experiencing fluid volume deficit. Might be skin impairment. You know, when we normally have that hydrochloric acid in the stomach, and if we have IBS where we're having chronic diarrhea, those things are not staying in the stomach. They're moving through the intestines very quickly. Well, our stomach tissue and our intestine tissue are made to handle that high acidity, but our rectal tissues are not. So if we're having frequent diarrhea, it can cause excoriation or a breakdown of that skin tissue around the anus. Increased stools with greasy food, implications, fluid volume deficit, and skin impairment. And that 10-pound weight loss in 4 months, what are implications? Might be malnutrition. It might be an intentional weight loss. So what do we do about these things? For bloody diarrhea, let's do a stool culture and make sure there's not an infection going on. We may have to do fluids, replace the fluids that are lost, whether it's oral or intravenous. We may need to give the antidiarrheals, do diagnostics for cancer, for illness, for perforation or infection. And this could include, among other things, doing those endoscopies, upper and lower, and doing the stool cultures. The history of the IBS? Well, there are medications out there. And review the treatment regimen. Maybe it's just not appropriate. Increased stools with greasy food. We may need to do some dietary education and teach the client to avoid greasy foods. The 10-pound weight loss in 4 months. This client may require some supplements or some healthy foods. And we need to be monitoring her weight.